skin is our canvas, we need to look at the characteristics of the skin layers and how they hold ink so we can make the best choices when we formulate, and you can make the best choices in color. We're going to take a general walkthrough of skin anatomy so you know what skin layers you are tattooing and what you can expect. This is not an in-depth class on anatomy, but just some touch points to help artists of all experience levels. What are the layers of the skin? The deepest layer is the subcutaneous tissue, which is made up of fat, connective tissue, and blood vessels. As artists, we should not be dealing with this layer whatsoever. If we do, the tattoo will be blurred and distorted in color, and most of all, there could be serious damage to the skin. The dermis is the second layer of the skin that contains our nerve endings, blood vessels, sweat glands, oil glands, and hair follicles. This is the sweet spot of tattooing where the ink will sit in the skin, but more specifically, the top layer of the dermis, the stratum papillar. The epidermis is the outermost layer that contains cells that produce pigment and protects the immune system. This is the layer that we physically see on our bodies. Fun fact, did you know that the skin is considered an organ? The largest organ, the same category as your heart, your brain, lungs, or liver. There is indeed pigment within our skin, but not the same that's in our inks, we promise. Instead, this is a fully biological pigment that results in the coloration of our skin called melanin. It is key for artists to keep contributing pigment such as melanin when deciding on the best color for their application. The Fitzpatrick scale is often used as a guide for color choices, but really the best choice is always a decision between the artist and the client. Each of the layers of the skin contain individual layers within, but we'll focus on the top two. The thickness of the epidermis and the dermis will vary depending on age, ethnicity, environmental factors, and the location of the skin on the body. Let's take a closer look at the layers of the dermis. The stratum papillar, seen in this image here, is the most superficial layer of the dermis. It lies directly beneath the basement membrane and represents around 20% of the thickness of the dermis. This is where you should be while tattooing for safe deposition. The stratum reticular or reticular dermis is the deep layer of the dermis, which is seen here. It accounts for approximately 80% of the dermis. The stratum reticular contains all three types of dense, irregular connective tissue. These fibers all help to give the reticular dermis strength and elasticity. If tattooed too deep in the reticular dermis, you will lose the crisp lines and it will appear faded after healing, in addition to any damage caused to the skin.